Hello and welcome to this session. In this session, we are reviewing the course outline. NUR 212 Medical Surgical Nursing 2. This is a 2-unit course. Okay, we'll be having 2 hours every week. You need to have done the Medical Surgical Nursing 1 and you have gotten your score. Is that okay for everyone? Great. The purpose of this course this course is designed to equip the learner with knowledge, skills, and attitude in the management of medical surgical conditions affecting the musculoskeletal system, endocrine system, and hematological systems. This course involves theory and practical sessions, so we'll take you through these 3 systems and we'll also be visiting the clinical areas so that you can be assessed on the same systems. Remember, the assessment link will be popping up where you're supposed to review the tool so that you know what you will be assessed in the clinicals. What will be your expected outcome for this theory course? By the end of the course, the learner should be able to describe common medical and surgical conditions affecting the system we've mentioned, musculoskeletal system, endocrine system, and hematological systems. Remember also the link for the anatomy of these systems would be popping up. You need to review the systems so that you can be updated. You'll also apply the nursing process in the management of patients with these systems, where we'll be looking at nursing assessment, nursing diagnosis, nursing planning, and interventions, and finally evaluation. Remember not to forget about documentation, because anything that is not documented is never and was never done. Number 3, you need to apply the knowledge of pharmacy in the management of patients with endocrine, hematologic, and musculoskeletal disorders. Guys, pharmacology is usually a challenge, but we are kindly requested to review your notes on pharmacology because you are going to apply that pharmacology that you have already learned in the one that is involved in the endocrine disorders, hematological disorders, and lastly musculoskeletal disorders. So the nursing care plan, we're also going to look at how to come up with the priority nursing diagnosis. Remember, prioritization of needs. We use Doctors ABC and Abraham Maslow's of need. So we use first of all Abraham's hierarchy of needs, where we divide all the needs for the patient into physical needs and psychosocial needs. So physical needs have to be attended to first, and physical needs will apply the Dr. ABC, where we start by looking at the airway, breathing, circulation, nutrition, fluid and electrolyte balance and pain before we can now go to psychosocial needs involving knowledge, anxiety, and so on and so forth. Lastly, we'll be looking at diagnostic tests related to musculoskeletal, endocrine, hematological system. So we want to know the nurse to tell us the pre and post care for our patients undergoing all these conditions. So remember, we'll be using a flipped classroom where you'll be able to be given this condition, you study them, we discuss them in class. We'll also be having both asynchronous and synchronous sessions. I'll also be sharing YouTube channels where you can be able to go through the materials that we have. Lastly, we'll be sharing journals related to medical surgical nursing 2, where you are able to be updated of the current activities being done by the other nurses in other countries. Thank you so much and see you in class.